Welcome to Face Values, the podcast where we peel back the layers of cosmetic surgery and skincare to help you understand how your skin is aging and what you can do about it. I'm Dr. David Jack. I'm a cosmetic doctor and skincare brand founder. I'm based in London. I've got clinics in London and Edinburgh. I've got a real interest in just understanding more about how the skin ages. So I'm going to be joined by lots of guests who are real experts in the field. So I hope you enjoy and keep tuning in. Today I'm joined by Dr. Jo Mennie, who is an aesthetic doctor. She's a trainee plastic surgeon and she's also got a degree in women's health. She's really interested in skincare around about pregnancy and the postpartum journey, and she also specialises in treatments in this period in women's lives. So here's for another interesting episode. Welcome, Jo. So can you start off just telling us a wee bit about yourself, how you got into what you're doing and what your main interests are in the world of aesthetics?
Yeah, sure. So I'm Jo. I am a plastic surgery registrar doctor and also have a PhD in women's health. And I work alongside David in his clinics. And I mainly focus on a kind of more women's health angle with regard to non-surgical treatments and skincare.
Mm-hmm. So how did you get into that? You said you did your PhD in women's health.
Yeah.
Like, what was the kind of stimulus for doing that?
Yeah. So I would say probably partly the PhD in women's health, and kind of gaining that expertise in that area and that kind of more scientific understanding. But also my personal experience of women's health issues. So when I was trying to conceive and having fertility issues, I had a lot of skincare issues alongside that whilst undergoing a fertility journey. And everywhere I looked, it was saying, don't use this, don't use that. Ask your doctor, as in your OBGYN. And I was looking at all this advice and I was thinking, this is ridiculous. My OBGYN is absolutely not trained in skincare, nor should they be. Their focus is elsewhere. And then the kind of more aesthetic world, again, it just seemed to be this barrier where women were told, no, we can't serve you during this period of your life. You know, go away, use natural things and come back to us, you know, after this period. So it probably came from a little bit of rage induced.
Sure, yeah.
Where I just thought that's not really good enough. And, you know, women, this kind of period of their life where they're having kids is not just a very simple 9-month period where they can wait. It's for a lot of women often a longer time period than that while they're trying to conceive or they're having miscarriages or they're going through fertility treatment. And also just in general, just coming off kind of hormonal birth control. The skin goes through so much during that time, and it can be a long time, and it can be multiple years for some women. So I just felt it would be really great if I could provide a service for women during that time, to not just kind of push natural remedies which don't do anything on them, but actually look into the science and offer some really effective skincare advice and kind of take them on that journey where they're going to be going through ups and downs with their skincare. You know, hormones are changing completely during that time period, and being kind of able to hold their hand during that time and saying, you know, this might help, or you might have struggled with here's what we can do now. And then kind of beyond the pregnancy aspect, kind of how to get the skin back to what it was or how to build that confidence back in women. So that's kind of where it started from, my own experience of not having someone to go to and just feeling like it was kind of a bit of a gap there. And just very naturally, it's progressed into this practice whereby it's now spilled over into kind of body treatments, which I do a lot of, as my client base has kind of gone through, the kind of initial client base has gone through their family journey. And now we are trying to kind of address the body issues, which
dealing with the aftermath.
The aftermath, exactly. And do you know what? It's not just as these types of kind of postpartum body treatments have really kind of have a light shone on them. It's not just that immediate period. A lot of my clients are several several years out from having their kids. But this damage is long lasting. It's not aging. It's like an injury.
Yeah.
So being able to help them when they've done the gym, they've done their PT, they're doing what they can with their diet, and just giving them the tools that they need to really repair that skin damage and the confidence back.
Yeah. Great. And in terms of going through the pregnancy journey or through the fertility journey and pregnancy and things, you said that you experienced some changes in your skin yourself. And what are the sort of typical things that people might experience when they're going through that?
So I suppose there's a few different groups of patients. So you have the women who have maybe been using hormonal birth control and they're coming off that for the first time, and that can unmask some issues in the skin, such as the breakouts. Then people who are going through fertility treatments, again, that can be a lot of sensitivity as well as the breakouts. And then women, when they fall pregnant, the 3 different trimesters, there's kind of a whole range of different things that are happening, but mainly there can be issues with breakouts. Not for everyone. It's not a given. Yeah. But the main thing that we try and focus on is pigmentation prevention. So when you are pregnant, your progesterone is super high, and you are more sensitive to the sun, and you do develop this risk of developing something called melasma, which is much more easy to prevent than to treat, although we do have methods to treat it. So we do a lot of work with certain safe topical skincares to help prevent the melasma, or in some people who might have had it already or are developing signs of it, to try and target it during the pregnancy, and then create a plan for kind of post-pregnancy, how we can really help reverse that. And then with the whole kind of group of whatever category people are in, there is obviously a lot of health anxiety with regard to what's safe and what's not safe. And one needs to be really considerate during that time of the kind of anxiety around about what's being used in the body and on the skin. So that's a big part of what we do as well. We talk about what is safe, what's not safe, kind of what are some alternatives that we can use that are effective. So just giving them that reassurance that they don't need to completely lose their anti-aging or their kind of anti-breakout routine, that we have strategies that we can target. So what sort of things would you say you would avoid in pregnancy and things that you can use maybe? So there are a couple which are definite no's and red flags. So that would be your kind of any of the retinoid families. We have to not be using them, and ideally as well not using them for 3 months before we fall pregnant. So when you do, and it's a really great time when you're thinking about trying to conceive, to actually try and change your skin routine for those 3 months before, and you can figure out what works for your skin rather than being so heavily reliant on, say, retinoids during that time period. So that's definitely no. Things like hydroquinone, which are used often to treat pigmentation issues, that shouldn't be used when you are pregnant. And then very high strength certain acids. So we can use acids, definitely, but we just need to be using them under the guidance of a doctor and making sure that their percentages are sticking below 2%, ideally. And that's where some medical advice is really helpful, because a lot of the time with formulation and products we buy, they don't actually say the percentages. So just having someone that's able to kind of guide during that time. So those would be the kind of top 3 things to avoid.
And are there any sort of online resources that people can look at for these sorts of things? That you said that there's kind of a lack of information, but is there anything now that's kind of coming?
So there is the European Working Group, which is a huge database of lots of different products. It essentially grades them. It's a lot of detail, but they do have a pregnancy section of their website, which is really informative. They probably are a little bit more on the side of caution, and I would say they're good for checking what not to use, but they don't really provide that solution of
what to use,
right?
And how about, so you mentioned that you do a lot of body treatments post-pregnancy. So there's obviously the pregnancy phase where people are kind of doing less treatments in clinic. in terms of if people are kind of used to doing treatments in clinic before pregnancy, are there things that you think are kind of safe to do during pregnancy that people can still be doing to kind of look after their skin?
So the most common in clinic treatments would be your Botox and your Profilo. And sadly, they are not licensed to be using when you're pregnant. And they never will be, because it's just not ethical for us to study it in pregnant people. There are some, and we've actually at the clinic developed a really great pregnancy facial. So that can really help just with the kind of congestion aspect of the skin during that time. And it does have some anti-aging properties and some anti-pigment properties as well, by using kind of physical stimulation to help improve the skin texture and pigmentation. And that is safe in pregnancy. And we have our acne facial as well, which we have designed a pregnancy aspect of it as well, so it is safe. But the injectables, sadly, no. And so I think a lot of what we do in clinic is based more on the skincare, along with the supplements, and then the facials kind of complementing where necessary, and just taking them on that journey, that if they are having a massive breakout, to come in and we can manage it in clinic, and hold their hand during that time a little bit.
And Jo, I know you've got a real interest in supplements also, during and post pregnancy. So how about supplements? What sort of things should people be kind of looking out for or thinking about with regards to supplements and diet?
Yeah, definitely. So in pregnancy, So when you're trying to conceive and pregnant, absolutely. I would say just a general pregnancy multivitamin as a baseline, but then adding to that some extra vitamin D, some extra methylfolate, and some extra choline. So what we know from the more recent studies is that these things can not only help with the health of the pregnancy, but can also help with baby brain development, which is a whole other episode of your podcast in itself. I won't get into that. So kind of thinking about mom, thinking about baby during that time as well. And we go, it's great just to talk all these things through. So when we do our pregnancy or fertility consultation, we do not just skincare, but we talk a lot about supplements as well. And the supplement world is sadly not regulated. So we also talk about the kind of quality of the supplements, because not all supplements are created equal. So we talk about which brands might be doing kind of higher checks on their ingredients, heavy metal tracing, all these things to look out for when you are buying supplements during this kind of very crucial time period. But that, supplements not just for the pregnant people, for everyone. I'd be giving them to everyone if I could. And we've actually been doing with the body treatments a group of patients that I've been giving the supplements to at the same time as going through the treatments to see how much more optimization of the actual kind of in-clinic treatments that they're having. So I'm a huge believer in kind of quality nutrition getting you the better results of what you're doing in clinic.
Absolutely. And you obviously you kind of specialize day to day in doing body treatments for the post-pregnancy period, and I know that you lead the way in the field of this. So what are your favorite treatments that you would say, or the treatments that you think give the best results in that kind of post-pregnancy, post-C-section period? So going back to what I said before, not just in the immediate period, it is definitely, there is a time period afterwards where you can still get benefit from, even 10, 15 years later, because what we're treating is damage, essentially, alongside aging, but mainly this kind of rupture of these small little fibres from all the weight of the pregnancy. And it's very difficult to get that back with diet and exercise alone. So I would say there's two areas that people usually come for, and that's the tummy, as probably expected. And what we find with that is that there's often this kind of vertical excess of skin or crepiness that people can see. So
there might not actually be that much fat in the tummy. It's more of a skin laxity issue that they just can't get the tightness back. And that makes sense. You've had a baby in your tummy. It's completely stretched your skin. You've maybe had 2-3 kids. It's totally expected. And then the other area, interestingly, that in the last probably 2 years I've been doing a lot more of is the thigh kind of saddlebag area. And again, it's all just making sense. You have this heavy baby's head in your pelvis, and then all these tiny little skin, little ligaments and elastin and all these structural elements of the skin just break under the pressure. They just twist and break. And unless you're doing something localized to try and repair them, it's difficult to get your kind of PT at the gym to try and target these zones. So there's this descent of the kind of saddlebag area, which is that kind of lateral part of the thigh that we see after having a baby. So those are the two areas that people usually come for. And then treatment-wise, I would say there's really 3 options. So we have now Profilo Body.
Yes.
Which is amazing.
Yep.
And that is really helpful when I would say there's kind of mild to moderate crepiness within the skin. Then kind of next level up, I would be thinking about our Morpheus 8 body technology.
So it's what actually is Profilo? Can you
So Profilo is hyaluronic acid, which is naturally found in the body, and they've created it into an injection. And when we inject it into the skin, it stimulates the fibroblasts, which are those cells that create the collagen, to create more collagen. So we get a very localized response. So we can be really kind of artistic in a way with the injection and really target the areas that we feel need that boost of collagen. And it's been around for a while in the face, and they've now released it in the body, and we're having some really fantastic results with it. So you get almost like a hydration effect within about 10 days of it, but the real benefit is about 6 to 8 weeks later when you get that skin thickening and that sponginess back in the skin. That's what the clients do.
And it's a couple of sessions for a Profilo Body.
So we would do 3 sessions 1 month apart.
Yeah, and then next up from that is Morpheus.
So then next up would be our Morpheus 8 treatment, which combines microneedling with radio frequency. And that is probably more the kind of moderate to severe crepiness in the skin. And again, that's 3 sessions, 1 month apart. And as you may guess, sometimes we combine those treatments together. When it's either moderate to severe, or the patient is looking for a somewhat quicker or higher results in a way. The benefit of combining them is that Profilo is quite a painful injection. It's quite nippy, like a bee sting. When you do it with the Morpheus, we use some numbing injections when it's the tummy, so you kind of don't feel it from that aspect. And then obviously you get a kind of synergy, everything happening at the same time. So results are a little bit better by combining them. Yeah.
And any other treatments you think?
So then we have our Endolift technology, which uses a laser, translating into kind of a thermal injury in a way, to stimulate the collagen from the deeper and superficial layers of the skin. But the benefit of the Endolift is that it can also help treat the fat layer. So for those clients that have a little bit of fat, kind of that they still can't quite shift, then it's really helpful for that. The worry with some of the fat dissolving technologies is that you would dissolve the fat, but then the skin wouldn't tighten. And not only that, it looks worse. You've like emptied out a plastic bag and it kind of looks even creppier than when you began. So kind of my view is complete loss of fat from the tummy is actually aesthetically in a woman perhaps not
a good thing.
Not the good thing because you lose that kind of support to the skin. But Endolift for people that just have that stubborn area is a really good option. And then at the same time we treat the skin. So you're not going to get that empty bag look to the tummy.
And what about things like cesarean section scars and these sorts of things as well? What sort of options are there if somebody has, say, a really bulky scar or they've got a puckered scar? Obviously, you do some surgery as well.
So first of all, we talk about kind of if they are able to use a retinol-based treatment, then we would think about introducing that into the routine. If it is very early on, we might think about kind of silicone-based topical treatments.
Yep.
And then moving on to in-clinic treatments, we sometimes with the Morpheus 8 will bring that down over the scar, because obviously we get the microneedling element, which we know is really great for scar remodeling. And that can either be done with the Morpheus, or it can be just done in microneedling sessions, which we also offer, and seen some really fantastic results with that.
Yeah. Great. And how do you, so obviously people have pregnancies of all different sizes and things. The skin is stretched to a greater or lesser extent. Some people have really sort of huge overhang sort of aprons of skin post-pregnancy. So how do you manage, if someone comes in like that, how do you manage those expectations and say actually maybe you'd be better to go down a surgical route?
Yeah. I think that's probably where you and I are fortunate, because our background is surgical training. We understand the limitations of non-surgical, as well as understanding the huge benefits that surgery can actually offer to the right client. And I think it's really nice actually to be able to present the spectrum to the client. And I always do that. We talk about expectations and we say, listen, this is the result that we can get you with Morpheus 8. And this is the level of improvement. If a complete flat stomach, in the case of the client that you're describing, is what you're looking for, this is not going to give you that. That's going to be surgery. And we can even have a small discussion about what that surgery may entail. Unfortunately, again, with my background, I have a really great network of plastic surgeons who do surgery privately. And I'm able to refer out, which is really lovely, rather than feeling like we have to treat them with something in the clinic. Yeah. We can, know our limitations as practitioners and be able to send them to someone who's very qualified, if that's the right thing for them.
Sure, yeah.
But obviously, we also see clients whereby surgery is a big red flag and a big no, and that's everyone's personal choice about where their appetite for risk is with surgery. And that's where the benefit is for the treatments that we offer, that we can provide that level of improvement with a kind of lower risk profile.
Definitely. Yeah, great job. And if you were to kind of predict the future, how things are going to evolve in the world of like pregnancy skincare, post-pregnancy treatments, what sort of ideas do you have about that?
Yeah.
What was kind of exciting you at the moment?
Yeah. So pregnancy skincare excites me a lot. I do think now we're getting into this age of more personalised skincare.
Yeah.
That there is an opportunity there to deliver that personalisation during the pregnancy, or like I said at the beginning, potentially that 4 or 5 year period where they're trying to conceive, having multiple babies, and someone's looking after you in that time. People want to feel like they're not just using something generic, like they're being listened to and that they are being given the right thing for them. And so that angle, I think, will emerge. And then the other aspect of it is a more holistic approach to kind of health and wellness and beauty, and really thinking about how can we maximize the results of what we're doing. And personally, I think a closer look at our nutrition, bringing that in alongside the treatments that we're doing, talking about, okay, we're doing this Morpheus 8 treatment on the tummy. We're talking about stimulating collagen. Okay, tell me, what are you doing the next 3 months? Like, where are your stress levels at? What are you eating? Let's talk about trying to remove the amount of ultra-processed food. Let's talk about increasing the quality of your supplements, increasing the amount of protein that you're having each day, and really thinking about what the body is digesting in order to get the results that we're trying to make it get. Sure, you'll get the results from the technology without doing those things, but how can we make it better? How can we be more efficient with our kind of health and wellness approach? And one of the angles that I think and hope will emerge is just thinking a little bit more in terms of women's health into product development. So women's physiology is somewhat different to male physiology, and really perhaps we should be considering that when we're making supplemental nutrition products, and optimizing what we can, because the hormones change throughout a woman's lifespan. When they're in their 20s, it's totally different to 30s, to 40s, to 50s. So why are all women in that time period taking the same thing?
Same thing. Yeah.
It doesn't make any sense. And how can we provide a solution to that without fear-mongering and without giving them a massive checklist of things to add to their daily burden? Just like providing the solution of that, providing a clinic where they can come and we've got all these things, the solutions for them. We don't have a list for them to go and research. We have the solution for them.
Yeah, sounds great. So the final question that I've been asking people, Jo, is what's your favourite treatment to have done or on yourself? If you could do anything, but only one thing.
Definitely Profilo.
Profilo, yeah.
Yeah, for a few reasons. Firstly, I'm impatient, and I like that the results are relatively quick. Yeah, and downtime is relatively minimal. And also, for me, I think a big focus is kind of skin health and getting that kind of look of healthy skin without the kind of need for makeup, and that's what I feel like it can do.
And have you got a favourite skincare product, would you say?
It's definitely Dr. David Jack's All Day
Of
Long
course,
SPF.
of course. I remember when you tried it for the first time, it's actually quite nice. Been trying to convince you for 5 years.
Oh my goodness, yeah, somewhat embarrassed about that. But it did go through reformulation. Yeah. I think I tried one of the first.
Yeah.
And now I am obsessed with it.
Good.
Yeah.
I'm glad to hear
wearing
that,
it today.
Fantastic.
Yeah.
Great. Well, thanks for coming on, Jo. It's been a pleasure to speak to you. People can get in touch with you through your Instagram, which is Dr. Jo Mennie, and then through my website. Yeah. And I'm sure that you're answering your questions on Instagram and things.
Yeah, of course. Yeah.
Great. Cool. Thank you, Jo.
Thank you for having me.
Pleasure. Nice to spend the evening with you.
Yeah.
So that was Dr. Jo Mennie talking about women's health and skincare and also treatments for the postpartum period. If you want to learn more, you can visit my website, which is drdavidjack.com, and you can also visit Jo's Instagram, which is @drjomennie. So thanks for listening. If you like this podcast, then hopefully you will subscribe to this podcast on whichever platform that you listen to your podcasts, and I hope to see you in the next episode.